Hi, Ulrika.
Hi, Sean. So nice to be here with you.
I know, and it's the NCDA Alliance Forum.
Yeah, I'm super excited. It's been such a fruitful conversations and discussions here, so I bring a lot back home.
It has. And, the theme of the forum, it's a call to action, leadership for 2025 and beyond. And with the high-level meeting coming, at the end of September this year, that call for action is just so important. And you've been a leader for so long.
Yeah, many years.
With the Swedish Cancer Society as the Secretary General, and now as well as the UICC President. What does that mean to you, to be a leader and that call to action?
I think it means bringing a lot of different stakeholders and interests together. And I think leadership is much more complicated today than when I started as a leader, because then you were able to do things on a sequence. You started one thing, you ended that one, and then started on the next thing. Now we need to put all the things on the table at the same time. And that goes for NCDs. We need to have a much more holistic approach to NCDs and cancer control, which is my core area. And need to involve so many different stakeholders and be so much better in setting clear targets of where we want to go and what we want to achieve in order to get everyone on board and do so many things at the same time, but at the same time in a very clear direction. And that's very much more challenging. And from your point of view, I mean, you've also been a leader in the NCD system and from the Malaysia Cancer Society for so many years. What's your take on the situation now? And
I think it's, I think when we first started the whole thing, it was the whole approach of you lead and people follow.
Exactly.
And now it's changed so dramatically because it's no longer, you forging the path, but it's you're bringing everybody with you to forge that path.
Yes.
The collaborative aspect of it, the whole of society aspect of it, that we all work together to that common target that you spoke of. And leadership, I think, is around that, is to get that passion from everybody, just not for the moment, because NCD is it's a long road. It's for that passion to be continuous and to move forward with everybody. So yes, for me, that's what leadership is all about.
Yeah, but I don't think it's just about passion, because I think what's also different now is that we need to sort of combine the health conversation with the financial conversation, not just asking for more money, but to build a different sort of case to be, and think about health as not just improvements in health, it's also building an economic resilience, and we haven't framed it in that sense previously. So it's a different narrative that I think we need to develop in order to really, truly get different stakeholders to work on this path, but from the private sector side, the NGOs, the civil society, and the governments.
True. And I mean, you mentioned it in the sense that it's everybody together, and that health systems at the moment in many countries are failing, that they're underfunded, they're fragile, and
fragmented.
And there's so many gaps out there.
Yes.
So how do we pull people together, to close those gaps, to have that critical leadership to ensure that NCDs are still at the top of the agenda in people's minds, that it's not too overwhelming that we can't contain it, or we can't tackle it, so we forget about it. And I think a lot of governments and a lot of civil society organizations even just get overwhelmed with the issue.
Yeah, and they feel that it's too much.
Yeah.
I think the challenge is, from a national perspective, I think we really need to build the narrative, and we really need to build a story that this is actually possible, and we need to set real clear targets. And it sounds a bit challenging that as a civil society, we set targets for a country where we should go. But I think we need to help our governments actually to set the targets and say that, for example, in 2040, we want to reduce the number of preventable cancer cases by X%, or we want to increase survival rates by XX%. And because that means that we need to do this and that and that, and we can also engage easily private sector partners, civil society and governments, and see how everyone can contribute. So I think we need to take a lead to guide our governments to take a lead.
I like the word. I mean, I like the phrase you say, guide the government. Because for many years, civil society organizations were seen to be on opposite sides to the government. And government didn't want to listen to civil society organizations because it was a criticism. We monitor, we check and balance. And for many, it's considered that, you're against us, you're not with us. So I think for us to all move forward together, it's very much the whole idea that this is what we need to achieve together. How can we be part of that journey with you? How can I help, or how can we help you achieve what is best? And I think that works again across the whole of society. If how can we bring everybody up to the table together, as you mentioned?
And I think it's such a hopeful way of working too that I really like. So, and it doesn't mean that we're not criticizing our governments, because we need to hold them accountable, and we will continue to do that. But it's a joint journey towards a common target, and I think that changes the situation and the dialogue a lot.
I think the other area as well is the longevity to the commitments of government.
Yes.
Governments come and go.
I know. That's why we need to bring other stakeholders on board as well.
Yes. And so it's how do you get that political will to continue?
Yes.
And Sweden has done it.
Yeah, but still, and it's so strange because, I mean, NCD, it's not a question about if you're a conservative government or if you're another more liberal government or what kind of government you have, the composition. It's not like NCDs are not important to them, because they are still people, human beings, and they themselves are affected when their families are affected. So, but they had different methods of taking on this journey. So I think when we create this common narrative, it's something that we can sort of continue to work even if the government changes. And the new government, they might have some different approaches and priorities, but we have enough other stakeholders to still hold the line.
But coming down one step away from the government aspects of it, disease.
Yeah.
We still look at disease silos.
Yes.
So you might have the policy, but how do you get that integrated into the healthcare? How do you get it integrated that everybody works together for that?
Yeah, I still think all countries need to make, high-income countries, low-income countries, we all need to invest much more in the primary healthcare to have a more people-centered approach. And so many people are suffering from or are affected by multiple diseases. So it's not just, you need to treat the person and not just the disease. I mean, you need to stop thinking about silos. And I mean, from a financial point of view, it might sound very expensive to have a very people or person-centered approach, but we know that it's actually more effective and you have better health outcomes. So it's more using the investments in a more effective way. But it's easy to say, it's much harder to do that. But it's shifting the minds and trying to do that and make that case sort of.
I actually think it's easier going for a patient-centered approach. I mean, being a civil society organization that does interventions, if I'm going to go out there and do cancer interventions, it's not hard to just add on other things. And so you're more proactive than reactive in terms of how we approach looking at the person in front of you. I shouldn't even say patient, because they're not patients as yet. But having said that, being proactive, what would be your call to action? What would be the one thing you would like to call out now?
I think we all need to be committed to setting targets that are sort of daring targets for the coming decade or decades. And we need to help and guide our governments to do that, and then hold them accountable for that. And you, do you have a call to action?
For me, yes. I mean, yes, we have to strive for the high-level meetings. It doesn't come often, so we have to strive for that. But that's where the work starts. I don't think that's where the work ends.
No.
We need to forge forward, as you said.
Yeah, focus on implementation.
So thank you. It was wonderful
Thank
talking
you.
to you.
Always wonderful to talk to you.